The South African Committee of Medical Deans and the SA Council of Dental Deans have recommended that COVID-19 vaccines be mandatory for health science students and for health workers, citing the high risk of infection in this sector. They've recommended that healthcare workers who have already received the Johnson & Johnson vaccine be given a booster shot. Let's unpack this issue now. We're joined by the Director of Universities SA, that's Dr. Linda Meyer, and the Acting Dean of the School of Medicine at Sefako Makgatho Health Sciences University. That's Professor Risenga Chauke. To both of our guests, thanks very much for your time this morning. Professor Chauke, let's begin the conversation with you this morning. And on the face of it, it seems quite reasonable, actually, that vaccines be mandatory for this sector.
Yes, good morning, Michelle, and good morning, viewers. We think it is important that we reiterate the fact that we think vaccination, especially for health professionals, should be mandatory, because we think and we believe that the benefits outweigh the risks. And therefore, with these benefits, it is important that we advocate and advance the fact that everybody should be vaccinated. One is that the risk of transmission is decreased 2 to 2.8 times. The risk of getting long COVID is also halved. And the risk of secondary infection to our family members, but more importantly, the risk to ourselves as health professionals is also much more decreased. So it is important that we advocate and to hope to influence the government and our principals to have it mandatory for health professionals to be vaccinated.
Dr. Meyer, it seems self-explanatory that people working in this sector are so much more at risk of contracting COVID-19. Having said that, are you experiencing pushback to this possible decision around making vaccines for the sector mandatory?
We must understand that this is a very complex and large debate which brings constitutional rights into the fray, and specifically Section 15, the right to religious freedom, and Section 12 around bodily integrity. But we must understand in terms of the Constitution that no right is absolute. And where there is something that is in the interest of the greater social good, these rights can be curbed. Now, nobody can be forced to take the vaccine. You must understand that. That is not a right that anybody can infringe. But what we can say is, if you want to be part of a particular program, if you want access to the sites, and we know in terms of Section 9 of the Constitution, public and private property rights, in terms of the Constitution, we can see that you have a right to say anybody that makes use of those facilities, that they must be vaccinated. And you can see that obviously by the signs when you go into the airport that says that right of admission is reserved, and they can search your body or your person, and there are specific processes that need to be followed. Now we've seen that particular directives have come out from the Department of Employment and Labour. So this is a big discussion, but in essence, what University South Africa is saying is that we encourage everybody to get vaccinated, and that we mustn't have the debate around issues that is not based in fact or science. We know that science says that if you are vaccinated, the chances of you getting severely ill is significantly decreased, if not completely eradicated. And obviously, that is not completely eradicated, but it is significantly decreased. And also, the primary issue is that the infection rates to other individuals is significantly decreased. And we must understand that in this situation, we have a social compact, and it is critical that as we unpack these issues, we make sure that the larger societal needs are never outweighed by individual issues that really impede on the rights of larger society.
Yeah, absolutely. Professor Chauke, in terms of the pushback that exists in the sector insofar as mandatory vaccines are concerned, can you put a number, can you put a statistic to it? How many people in the sector are refusing on various grounds?
Unfortunately, I don't have the number at the present moment as to how much, but we realize that as the age has been increased to say that 18 to 35 must be vaccinated, Anecdotal evidence suggests that more and more of those cadres are coming forth to be vaccinated. And we believe anecdotally as well that encourages even the older age groups to come forth to get the vaccine. Yes, indeed, there are still sectors within pockets of resistance, but we believe that as others have resisted before and experience has taught them that either their relatives or their close spouses have passed on because of the COVID disease, they themselves therefore are volunteering to get vaccinated. We think if you can put face to these experiences, it will go a long way in demystifying the myth that there's something wrong with the vaccine and therefore people should not be vaccinated. But we think that going forward, more and more people, and we hope that more and more people can come forth to get vaccinated.
Yeah. Dr. Meyer, so we're talking specifically here about people in the health sciences sector and the medical sector. But insofar as what you've described earlier, no one can force anyone to get a vaccine. That's point A. But the second point to that is that you may well, upon refusing a vaccine, find your own movements curtailed.
Absolutely. And we must understand in terms of the Employment Equity Act, in terms of the Constitution, any a process that is fair, reasonable and justifiable will be held up by our courts. So this is not about forcing anyone to get the vaccine, but it is about saying if you want to make use of our processes, our facilities and our programs, that you need to do this. So this really is important for us because we must understand in terms of the Occupational Health and Safety Act, there's an obligation on the employer to make sure, and also when you're working with members of public, to ensure that you keep your workplace safe. And Section 11 specifically says that of the Act, that if you are working with the public, if you are working in public health, for example, or in a shopping center, that those employers have an additional burden to ensure that their customers and their patients, therefore, are safe. And if this is not done, it then becomes a criminal offense. So as I said at the onset, this is a very complex debate, but we must understand this is not about infringing anybody's rights. This is about looking at the broader social collective and making sure that we do everything that is humanly possible to protect our staff, to protect our students, and most importantly, to protect the members of our public.
So the Committee of Medical Deans making this recommendation that the vaccine is mandatory. Professor Chauke, it's a recommendation at this point. When do we reckon we'll see that finalized?
Well, as our statement clearly states that we want to make it compulsory, but if it has to become mandated, it has to be driven from our principals in government to make sure that they pass the rules that will therefore make it necessary for everybody to get vaccinated. Certainly in the public sector, as Professor Meyer says, we can't force anybody to be vaccinated. But we are seeing it more and more in private companies that those companies are insisting that their employees get vaccinated because they want to protect their clients, protect themselves and make sure that the economy runs again. And if we don't do this, it means we will remain in lockdown and therefore really stifle the development and the resuscitation of the economy.
Yeah, absolutely. And it's a conversation that is getting more and more widespread as the months of the pandemic do pass. Thanks very much to both of our guests for weighing in on this important discussion. Dr. Linda Meyer is Director of Operations at Universities SA, and Professor Risenga Chauke is at the Sefako Makgatho Health Sciences University. Thanks very much indeed for your time. So this recommendation from the Committee of Medical Deans, really an appeal that they have compulsory vaccines. They say it's also for the protection not only of healthcare workers themselves, but certainly for those in their care as well.